Crowds of people turned up at Waigini Central as early as 6:30 this morning for the Cancer Awareness Walkathon. The walkathon was facilitated by Pacific International Hospital to raise awareness on cancer.
Hey, EMTV, why am I out?
The Health Secretary, Dr. Osborne Liko, who was also part of the awareness walkathon this morning, mentioned that breast cancer and cervical cancer are the two most common forms of cancer that affects women in PNG.
PNG continues to face what we call triple burden of diseases, from the infections, chronic illnesses including cancers, and of course trauma. 47% of PNG or deaths in PNG are from non-communicable diseases, including heart disease, complications of diabetes, and cancers. The most form of cancer in PNG we all know is cervical cancer and breast cancer for our women. This has a huge emotional, mental, and economic impact on families throughout PNG.
Meanwhile, Dr. Dama from the Pacific International Hospital encouraged women to go for screening methods to avoid cervical cancer.
The most common cancers in women are cervical cancer and breast cancer. So mainly cervical cancer is very in the high raise nowadays. So for the awareness, we tell about the screening methods which all the ladies should do. That is a screening method is a pap smear, which is done once in 3 years. Once the lady starts her sexual activity, then you at the age of 21 or something, we have to start doing the pap smear once in 3 years. And if any abnormal pap smears, we need the further treatment. And almost to prevent, nowadays we have a vaccination for cervical cancer.
She also mentioned that breast cancer is most common in women reaching 40 years and above.
Breast or any nipple retraction or any abnormal discharge from the nipple, they should consult a doctor immediately. There is no age such, like it can be in younger age, but usually more above 40, it's very common. And most probably in elderly women also like 60, 65, it's quite common breast cancer. But the cervical cancer, what we are seeing is here is the like women, they are getting in 30s, even early 30s and early 40s. Most patients are coming with cervical cancer.
The consultant oncologist from PIH also encouraged the public to go for cancer treatment at the early stage.
The key to preventing cancer, it is always better to turn off the tap rather than mop up the mess. So prevention is turning off the tap. In order to turn off the tap, we need to address cancers when they are in an early stage.
Esther Gane, National EMTV News.